Uh, I've got some good questions on the platform regarding stage 3 melanoma after treatment with immunotherapy. So as you know, stage 3 melanoma, that's completely resected. People will get 1 year of adjuvant treatment, whether it's pembrolizumab or keytruda, nivolumab or Opdivo. And for those people with a melanoma that has a BRAF mutation, sometimes they may be treated with 1 year of targeted therapy, we call it dabrafenib and trametinib, to prevent the melanoma from coming back. And I've got some questions from again, as I said, the platform about what the chance of this melanoma coming back if I had a stage 3A that, the surgeon removed it and I completed treatment with immunotherapy, or what's the chance of stage 3B coming back and 3C coming back. And in particular, the question was regarding the pembrolizumab after we complete pembrolizumab treatment. And today I'll be talking about the 5-year recurrence-free survival data. This is a 5-year data from one of the major adjuvant trials called the EORTC 1325 or the Keynote 057. In this trial, about 1,000 people were enrolled after surgery. They all had stage 3, 3A, 3B, 3C. They got a surgery, and after that they were randomized to 2 groups. One group, half the people did not receive any immunotherapy, and the other half received keytruda, 200 milligram IV infusion for a total of 18 doses or a full year of treatment. This study was published in the New England Journal of Medicine, and that's the title, 5-year analysis of adjuvant pembrolizumab, again, keytruda, or placebo in stage 3 melanoma. And the authors looked at the recurrence-free survival. So what is the recurrence-free survival? It is the time frame from randomization until the person developed a regional recurrence, meaning the melanoma came back around the area of the surgery. So it's again the time from starting the treatment or randomization, starting the treatment, until the first recurrence, meaning the melanoma, the first time the patient saw or the person saw the melanoma coming back around the area. That is what recurrence-free survival is. And as we can see here, for stage 3A melanoma, people who got keytruda, the recurrence-free survival was 73%, way more than the placebo. The people who got the placebo, meaning the people who did not receive any drug, the recurrence-free survival was 59%. That's for stage 3A. For people with stage 3B, the recurrence-free survival was 58%, and that's at 5 years from the treatment. Again, at 5 years. We have 58% for people who got keytruda compared to 39% for people who did not receive the drug or received the placebo. And stage 3C, the recurrence-free survival is 45% for people who got the treatment versus 30% for people who got the fake placebo. That means they did not receive the treatment. So based on the results of this treatment, pembrolizumab or keytruda works well. It works in the adjuvant setting, meaning it's a good treatment to receive, or one of the approved FDA approved treatments to receive for stage 3 melanoma if people underwent the surgery and the melanoma was removed to decrease the risk of recurrence. And I showed you, we have a 5-year data showing that keytruda works well, and indeed it decreased the risk of recurrence. But also in the same trial, it showed that this drug also decreased the risk of distant metastatic disease. And it is given IV infusion once every 2 weeks for once every 3 weeks for a total of 18 cycles or 1 year. There is a new approved dose is keytruda to be given 400 milligram once every 6 weeks for a total of 1 year as well. So that's it. That's kind of like a quick review of the data, and also hopefully some of the people on the platform, this data will help them in understanding what's the chance of this coming back if you receive keytruda for 1 year or if you don't receive keytruda. So you can see all of that in the table provided.